Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing quite well, thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines and our lone U.S. COVID statistic through today, July 18th. We invite you to submit any questions or comments you have down below in the comments or at any of our social media linked in the description. Starting with that abbreviated COVID statistic, average COVID deaths in the last reported week were 22 daily. The same week in 2024, we saw 52 daily COVID deaths. Dr. Murphy, your reactions to those numbers and the state of COVID in the country?
Yeah, so it's pretty much been the same over the last few weeks. We're at this kind of bottom, early summer amounts. There's some very preliminary data that shows there may be an uptick in some wastewater samples around the United States. So that could be the beginning of the typical August bump that we have, but that remains to be seen. But we've had a summer bump occurring in the late summer, mid to late summer, since the beginning of the COVID pandemic. So, it remains to be seen, but that should be this wastewater surveillance could be very helpful in predicting when that's going to actually happen.
And can you remind us, we're seeing what could be a possible uptick in cases through wastewater. How long roughly does it take for that to reflect in the death numbers that we get?
Yeah, no, well, so it's very much not too related to the death numbers because you have to have the infection first. You have to get sick from the infection. You have to get admitted to the hospital and to the ICU, fail therapy, and die. So there's many, many weeks before you see a change in the death. And we're not reporting cases. We're just reporting the number of deaths. That's the only metric that we look at now.
And speaking of something that prevents death, vaccines. There was a massive Danish study released at the end of last week or early this week about aluminum content in childhood vaccines and the safety. Can you tell us that data?
Yeah, this is a huge study of 1.2 million children from Denmark, which has, incredibly good centralized record system of everybody in the country. And they were trying to link the amount of aluminum that children had received as part of a vaccine. Aluminum is put in many vaccines as an adjuvant. Now, what does an adjuvant mean? An adjuvant means it just enhances the effect of the vaccine. It's been around for a long time, and aluminum is kind of in a lot of stuff. We're exposed to aluminum all the time. Every time you have like a can of soft drink or a beer or something, or anything in a metal, there's aluminum in there. There's aluminum all over the place. We've been exposed to aluminum for a long time. Very, very small amounts, of course. So anyhow, so they looked at high aluminum versus low aluminum or no aluminum, and they tried to associate it with 50 different chronic diseases. And this all went back to a former study that has since been discredited that showed that there was an increased risk of asthma in people and children with high aluminum exposure. And so they did this big study. They looked at people from 1997 to 2018 and followed them until 2020. And they've done this big analysis. They find no link with any of these 50 different diseases, all sorts of diseases. So it just shows that this amount of aluminum is safe is to use in this very, very small amount that they have in the vaccine. So it's just great data that confirms what we've suspected all along, that aluminum in this kind of dosing is safe to have in the vaccine products.
Absolutely. And on the topic of safe vaccines, while we look forward to the upcoming respiratory season, it seems that some manufacturers have started shipping out those vaccines for us to be ready. Can you tell us which ones?
So we start giving out the vaccines in September typically, and multiple companies, CSL Seqirus, Sanofi, MedImmune, and others have started shipping their vaccines out already to get prepared for distributing these vaccines during the flu season. Remember, every year we change the vaccine based on the type of flu that we expect to hit the population in the fall.
hmm So great news that those will be ready for us upcoming this respiratory season. But something that has continued to ravage us here in the United States is this measles outbreak. We got another update this week. Numbers continue to rise. Can you tell us about it?
Yeah, so the total number of cases of measles since this recent outbreak in Texas is now 1,309 cases in 40 U.S. Jurisdictions. So that's the highest since 2000 when it was zero. We now beat 2019 where there were some 1,274 cases. So almost all these predictably were 92% or so were from unvaccinated or people with unknown vaccine status. Of those cases, 13% or 164 cases were hospitalized and 3 have died. All of those were unvaccinated cases.
And we're seeing community spread. I understand that the CDC is able to monitor measles through wastewater as well.
Yeah, they've looked at wastewater and they found it in places basically as remote as Traverse City, Michigan, in the north of Michigan here, a small town up there, very beautiful area, but all over the country, Indiana, Colorado, Kansas. I mean, it's just kind of everywhere.
Mhm. And what could this mean for the United States elimination status?
Well, I don't think it's going to be eliminated unless the vaccine uptake rate increases. It's down in around the low 90%, 92, 93%, but you have to actually have higher than that to really suppress everything. And then you have communities that won't take it. And that's where you see. And so what's happened is those, now that we've had this outbreak, it's hitting like every other area in the country where the vaccine rate is low. So unless we get that proportion up, this will be just here forever.
Mhm. And something that we haven't talked about a lot here on the show, something very interesting, is that kissing bugs who may carry chagas disease may be endemic in some southern US states, and they're cropping up in Florida. Can you tell us about this study?
Yeah, so this was a study from the scientists at the University of Florida and Texas A&M, published in a very good journal this week, PLOS, Neglected Tropical Diseases. It's the name of the journal. So they looked at 300 of these kissing bugs, or triatomines is what they're called. They looked in 23 Florida counties, and they found that 30% of them were carrying Trypanosoma cruzi, which is the bug that causes Chagas disease, which is all over the Americas. It's very big in Brazil and many other places. Not so much in the United States, but now, I mean, they've just shown that this thing is endemic in the United States. So it's something people have to be aware of, that there's this much risk in the United States. Chagas disease is now possibly, it's a US problem now as well. And why is that important? Well, Chagas disease actually can cause heart disease. It can infect the heart, and cardiac failure is one of the problems associated with Chagas disease. Some people have no symptoms, it's a whole gamut of things, but it's classically can cause heart disease. So they've found these bugs in 23, mostly southern and warmer states. And we'll see what if more of this pops up.
Mhm. And speaking of bugs that are causing us problems here in the United States, there's also been problems with mosquitoes, of course. And there's a new study showing how climate change could help increase West Nile virus. Can you tell us about it?
Yeah, West Nile virus is one of these flaviviruses like Zika and dengue, yellow fever, and the more you look, the more you find. So Illinois is a big reporter of West Nile virus because they've had a surveillance program for a long time. Now, New York, they had the first case detected in 1999, and now it's endemic in New York State. And so they've done the surveillance test, and they found that it's up there and it's endemic. And they found that the correlation with how much West Nile virus is related to increased temperature. So the warmer the season, the more West Nile. The cooler, the less. So as things warm up, we're going to see more and more West Nile virus. There was actually a vaccine made for it, but nobody wanted it. They weren't seeing enough problems with it, I guess, and they basically gave up on the vaccine. But there was one at some point. That might have to be revisited, but it did exist for a very brief period of time. So we'll see what happens with West Nile virus. It can cause encephalitis. It can cause many problems. Typically not fatal, but it can cause problems.
Mhm. Now, speaking of revisiting something that was once a very, very large problem, if we head over to Arizona, there was a recent plague case that unfortunately was fatal. Can you tell us about it?
Yeah, plague is caused by a bacteria called Yersinia pestis, and it's associated with the pneumonic plague. So you think plague, you think of the Middle Ages and whatever, but plague does occur in the United States. On the average, there are 7 plague cases reported each year in the United States. So it's not zero. And in Arizona, the Flagstaff Medical Center confirmed a patient was infected with the plague, which caused a severe lung infection and death. Plague can be treated and cured through antibiotics, but the treatment has to be given right up front. And so you have to suspect that they have it, test for it, and treat it.
Mhm. Now, this goes along with our next story as well, but if you see dead animals, don't mess with it.
No,
Leave it to lie.
stay away from dead animals, please. Yeah.
And on that note, there have been more cases of H5N1 avian flu across the globe. Can you fill us in?
Yeah, so Bangladesh and India have reported new cases of avian flu. Bangladesh was a child who had respiratory symptoms, and they tested, and it was avian flu. Um, the child did have contact with backyard poultry, and that's the 11th case since 2008, 3 of them occurring in 2025, so the first half of 2025. The other case was in India, was in a male from Karnataka state whose sample was obtained in May, and he since has died. And they had another case in a 2-year-old in April also who died. So, you have these 3 cases, 2 are dead. They have this higher mortality rate, or it's the way they're reporting the disease. Maybe there's many more cases, we don't know, but it's disturbing. But it still falls into the most likely associated with animals giving it to humans, not human to human
Mhm.
transmission.
Absolutely. And our final story today is one that has been long running regarding funding cuts for US aid and other programs like PEPFAR. I understand there have been some funds that were spared from those cuts, but we're still seeing massive fallout. Can you fill us in?
Well, Congress originally appropriated 6.5 billion to PEPFAR. And they are supporting a huge chunk of AIDS screening and treatment for men, women, and children throughout the world. This was all just completely cut out. Many clinics and NGOs had to shut down. They're not treating these people anymore. It just was quite devastating. So they're preserving 400 million out of the 6.5 billion. I mean, that's not even 10%. But it's something. And hopefully that's going to help. It will help, but to a much more limited extent than planned. So to date, before this all got cut, over 25 million lives were saved because of PEPFAR. And what is projected now with this big gap in the support for the treatment, there's other people treating. I mean, but you're talking about a worldwide problem with millions of people. They have to take a medicine every day. They predict in the next 4 years, there'll be 4 million more AIDS deaths and 6 million more HIV infections because of this lack of support. Or I should just say the abrupt discontinuation of the support. I mean, we've mentioned this before. I mean, there's ways to, stop providing life-saving medication. I mean, you can taper it off over a period of 1, 2, or 3 years or something like that. Find other donors to pick up the slack. There are many other donors involved and many other countries involved in providing the medications. The medications are, down to about $15 a month, if that. And that's not the way this was done. So there's this big gap, and millions of people are going to die. And beyond HIV and AIDS, a lot of this money is used to support children who are at risk for vaccine preventable diseases. And, a lot of this is, there's at least more than 14 million children are vulnerable to vaccine preventable illnesses, and an additional 5.7 million with only partial protection because they haven't received the full immunization schedule. So again, stopping this, it's going to be devastating for children around the globe. If you look back over the past 50 years, over 150 million lives, mostly children, have been saved because of these vaccine programs. And the reason why children around the globe are not vaccinated has nothing to do with vaccine hesitancy, believe me. It's really because they don't have access to vaccine services. So that's the hump we're trying to get over, and now that is impacted as well.
Absolutely. And it's important to note that while these are different programs, they are interwoven on the ground and in action. Maybe one group is funding the purchase of these medications or
Right.
this, and then other groups are moving those vaccines. Another group is giving them to the people on the ground. So a cut somewhere is a cut everywhere.
Yeah, it's called implementation. You not only have to have the vaccine, but you have to give the vaccines. You have to have the supply chain. You have to get the vaccines out to where they're needed. You have the people in the groups to give the vaccines, to recruit the patients, to offer it to them. And, the people in many of these poorer countries, they know that they palpably see what happens when they don't take the vaccine. Their children die young, you know. So they take the vaccines. It's just getting the access.
Hmm. And
And
it's incredibly important that, yeah, as you mentioned, this is not a hesitancy problem. It's
no,
a massive privilege for, people like us in the United States to choose not to receive these vaccines.
and the world, European Union, Canada, there are many, Japan, many other wealthy countries that do help in this matter, and the countries themselves. These poor countries, not every country is that poor, and they can step to the plate too, and they do. Like if you look at middle income countries compared to low income countries, the low income countries really don't have any resources are really to spare. So they're the ones that are impacted the most. So the poor really suffer the most, as you would expect. But the middle income countries they do much better, and they do support these programs themselves.
Well, thank you so much, Dr. Murphy, for your time and your expertise, for educating us on all of these important topics. It's very, very much appreciated.
Well, thank you, Katie, and have a great weekend.
Thank you, and thank you all for joining us for this week's episode of Ask Dr. Murphy. We hope to see you again next week. As always, any questions and comments are welcome down below or at our social media linked in the description. Have a nice weekend.